Dr. Beck, there was some news out there lately on one of those morning shows which had to do with nerve damage caused by denture cream. You know, that stuff, I guess, you put in to hold or clean your dentures. Actually, I don't know, and I haven't seen the show. But it seems to be picked up by all kinds of little and bigger newspapers. You being very, very specialized in the subject of nerves, what do you have to say about it? Are you familiar with it? You seem to be, you nodded a little bit to me here.
Yeah, I'm very familiar with it. This story broke, a couple of weeks ago, maybe even a month ago, and it's been all over the news since then. And if you do any kind of Google search on the web, you'll see lots of information related to the use of denture cream and nerve damage. And this is based on actually two studies that were done, one in 2008 and then one in 2009. And this is really just now percolating up to the top of the public awareness. And in these two studies, and they were small studies, but both studies, they found an association between the use of denture cream, which has a high level of zinc in it, and nerve damage.
Really?
Yeah, it does have zinc.
They taught me in school not to chew on my ink pencil.
Yeah. It's a zinc metal is in the denture cream. And what they found is that if you get too much zinc into your system, it causes your copper levels, another metal, to go down. Now, if your copper levels go down, this causes nerve damage. And it can be nerve damage both in your central nervous system, that being your brain and spinal cord, and in your peripheral nervous system, that being the nerves in your arms and legs. So it's a multiple nervous system involvement that they feel is possibly related to the use of denture cream and excessive use of denture cream that has high zinc content in it.
Wow. So first of all, when I said they didn't let me chew on my ink pencil, I understood you said ink, but you said zinc.
No. Zinc. Yeah.
Zinc. Okay. With a C like zebra. All right. I got it. Now, what you just said? So fine. So the denture paste creates nerve problems. Number one, what kind of nerve problems? Mm-hmm. And so what should people who need no more dentures, only implants? Is that the solution, or what's the deal there?
Well, I don't think people should stop using denture cream right away. I mean, these studies were both small, and they don't really prove that denture cream causes nerve damage. What they found, there's an association between the use of denture cream and nerve damage. In other words, the people that had the nerve damage were found to have used a lot of denture cream. But that being said, if you do use a lot of denture cream and you start having problems, you really need to get it checked out. And this is what I want to emphasize to people. When in doubt, check it out. If you're having problems like numbness, tingling, burning in your hands or feet, or unexplained weakness, difficulty walking, difficulty getting up and down out of a chair, you need to go see a doctor and get nerve testing and possibly an MRI scan to see if you have any kind of nerve damage, which may be related to the use of this denture cream.
I see. Okay. Well, maybe if this bears out to be, I have heard from many dentists these days that even dentures, you can do them with a couple, 2, 3 implants, and then they don't sit and get glued to the gum anymore. So I think, at least, and perhaps I think the denture cream actually can be eliminated, while yet the denture is way more fixed, stable, and not pushing at the gum, and which is probably why you use the cream to soften the impact, almost like a Nike shoe, I guess. You soften the impact. And again, that's just my made-up thing. But I'll check this out with dentists and let the information flow through to them. Not that they probably haven't heard by now about it, because it has struck a chord, most likely, it looks like. But so what you say is get it checked out, see whether the nerves are okay. So if you have numbness in the leg, the hand, the feet, and at the same time for quite a while already you're using denture cream, check it out. It may not be anything, check it out. However, numbness in the feet, in the legs, in the extremities, simply isn't a good thing even at age of 80. It isn't necessarily normal. It should be at least addressed. Can it be totally fixed and avoided? But it can be diminished. So overall you have it longer, because numbness means your circulation in that area isn't anymore strong enough. Things are blocked somehow. And a good test can, with the appropriate treatment, then unblock those things and make overall your lifestyle better, I suppose, and most likely longer, because, I mean, it only takes so long till you die from here to here, and all of a sudden you become numbing all over the goddamn body.
Yeah, well, the numbness or tingling usually is a sign of nerve damage. So whatever the cause of the nerve damage, you need to go find out what it is and what's causing it.
So a person whose hands fall asleep, let's say almost every night, would that be a sign to do something? Not necessarily to do with the denture thing, but just he has a numbness, obviously, right? A tingling. That's what you get when they fall asleep. He sits at his desk, and not just sometimes when he crosses his legs wrong way, but frequently, once or twice a day, he gets numb. Should he do something about it?
Yeah, a lot of people think this is a circulation problem, but anytime you have numbness or tingling, it's a nerve problem. And when you have a nerve problem, you want to find out what is going on before that nerve damage becomes irreversible.
I see. So what you're saying is here, a tingling and numbness in the fingers and in the feet and then falling asleep. Is that part of it? Is that the same thing? Is not a circulation problem.
Yeah, exactly.
I just called it a circulation problem a minute ago, but it's not.
No, it's caused by a nerve problem. Something's happening to the nerve to shut off the sensation to your brain. So you need to find out what's causing it and what's happening to the nerve to make your hands get numb, tingly, and weak.
What are some of the causes sometimes?
Well, hands falling asleep at night, carpal tunnel is really common. When I see people that their feet fall asleep when they cross their legs, sometimes you're pressing the nerve in your knees that's causing nerve injury or embarrassment going to the foot. Sometimes you can get pinched nerves in your hip muscles, so from tight muscles on the sciatic nerve. So there can be a variety of reasons why it occurs, and the only way to really sort that out or figure out what's going on is to come in, have a good physical examination, and do nerve testing.
And then once you find out that it is the nerves, what's usually the treatment for it?
Sometimes the treatment can be very simple. For example, if I have carpal tunnel syndrome, if it's not too bad, some exercises and wearing a brace will help. Sometimes if you have a pinched sciatic nerve in the hip, some very simple stretching exercises will fix the problem. So it doesn't necessarily mean you're going to have to rush off and have emergency surgery or undergo painful injections. Sometimes there are very simple things you can do for it. But again, you've got to figure out what's wrong before you can treat what's wrong.
Do nerves need to be nourished like blood or other things? Is there like some type of like something you do rather than exercise? Exercise obviously is one of them, but we kind of like look at exercise of muscles, but apparently that relates to nerves, as you just said. But there's some way to keep nerves overall in good shape, some type of herbs, whatever that may be, Chinese herbs. I don't know why we all think that Chinese herbs are better than other herbs, but
they're exotic, right?
Right.
I think the one best thing you can do to keep your nerves healthy is keep good control of your glucose if you're a diabetic, keep your lipid levels down if you have cholesterol problems, and then make sure and take probably a daily vitamin to make sure you get adequate amounts of vitamin B6 and B12 and things like that, to make sure that the nutrients, like I said, the feeding block or building blocks for the nerves is present so they can regenerate themselves and stay healthy. Now, back up to one of your other questions, the nervous system is very dependent on having adequate blood supply. And so if you have blood vessel damage like you see in diabetes, then it can cause the nerve to die. So you want to really make sure you keep those vessels in good health. Not smoking, keeping your cholesterol down is one great way to do that.
So, okay, while a tingling does come from the nerve damage at the same token can be triggered by not enough blood supply, which could be a circulation problem to a certain degree.
That's correct.
It's very interlinked, I would say. Huh?
Yeah.
Incredible. Now, I personally, tell me, shed some light on it. I personally relatively regularly, and again, because I'm basically a lazy, kind of sloppy guy, it looks like, only do things when I need and want them. But I do drink I eat vitamins by the truckloads. I drown myself in those things. And I change them around and do all kinds of things. I try something new all the time. But one of the things I do relatively regularly is I drink magnesium. Put it in hot water, and drink it. And frankly, I do that. I sleep better. I get less cramps. If I go skiing and I do it before and after, I seem to be feeling a great difference how fast my muscle pain is going away. Now, am I now talking something totally different, muscle versus nerves or whatever? But anyway, can you tell me something about it? Why it works?
Well, nerves and muscles both require what I call micronutrients, small amounts of different metals. We talked about what happens if the copper level goes down. It can cause nerve damage in your system. There's other trace elements like magnesium, zinc, selenium that you find in vegetables, particularly vegetables that come out of the ground. Now, depending on where your vegetables come from, you may have low levels of those trace elements. And so I at least recommend people make sure the multivitamin has many of those elements in it. For example, if I don't eat fish and don't eat iodized salt, I need to get some type of source of iodine, which is another metal, into my system. Otherwise, I get a big goiter in my neck and can have all kinds of problems. So I think it's very important. Now, there's a lot of debate about how much of those things you should take. But I think, the quantity, at least in a multivitamin, is certainly reasonable and can help ward off potential problems in the future.
Okay. All right. And what about the magnesium in specific?
Yeah, and magnesium is just like a lot of the other ones. You have to have it. And one of the things I check with people who have muscle cramps is I specifically do blood levels of their magnesium and see where it's at, because it certainly is critical for healthy muscle function.
Okay. So it's kind of, my answer was like, is it more going towards the nerves or the muscle? But it seems to be, because I'm now confused which one is the nerve and the muscle, but apparently, so that's more kind of towards the muscle. And that makes sense, because as I said, when I go skiing and I know I'm going to have a little muscle like next day, if I do the magnesium, I'm better off. If I don't take it for a long time, I seem to be at night getting a little cramp here and there, and then I take it for a couple of days, and next thing you know is I don't get any cramps anymore.
Yeah, let me clarify for you. I guess both tissues need magnesium, but low magnesium levels frequently come out more as muscle problems than nerve problems in my experience. In other words, muscle cramps, muscle pain, inability to exercise, that's what I normally see when people have low magnesium levels.
Okay. Well, thank you very much. I appreciate your candidness and definitely your great knowledge about the anatomy of the body. Thank you very much, Dr. Beck.